Again, that was Dr. Samura Kamara, Foreign Minister for Sierra Leone, one of the hardest hit countries, talking with the heat during his trip to Washington this week. Now, fighting the disease is posing a huge challenge for healthcare workers. The International Red Cross is helping to coordinate that effort on the front lines in West Africa. Joining me now from Geneva is Benoit Carpentier, Senior Communications Officer with the International Federation of the Red Cross and Red Crescent Societies. Welcome to the show.
Thank you.
You are helping coordinate the International Red Cross. What is being done right now?
At our level, we're involved mainly at community level. What we're doing is we're working in the communities to try to disseminate clear messages on Ebola, how it's transmitted, how you can prevent it, and what to do if ever you feel first symptoms of what could be Ebola. We're also working in the communities to try to dissipate fears, and because there's a lot of fears and a lot of stigmatization around the disease. So we are trying to work with them, talk to them, listen to them about these fears so that we can have access to all the people. And we are doing activities around dead body management, taking care of the dead bodies, of the disinfections of the houses. As from next week, we will also be setting up a treatment center in Sierra Leone on the request of the Ministry of Health, treatment isolation center in the Geneva region, where we'll be dealing with patients directly.
What are your most urgent needs right now?
Well, the needs are quite simple. We need more resources and more people. We need to be able to train more people. We need to be able to conduct at a larger scale what we're already doing. We need to trace people. That's one of the activities the volunteers are doing, to try to do contact tracing, meaning trying to identify, locate, and monitor all the people that have been in contact with people infected by Ebola. And for that, we also need resources. We have appeals that have been launched, and then for now, that are really clearly underfunded.
Benoit, as we know, there is no known cure for Ebola, and several health workers have already died trying to fight this disease. So in many respects, it's posing a really unique challenge for health workers like yourself, isn't it?
It is. I mean, it's the most at-risk people are the families of the people that are infected because they are close to them, and the second category of people are the health workers. And very unfortunately, a lot of them have been deeply impacted by the disease. So that's why we need, all the resources possible to be able to take all the measures possible to protect all the volunteers and all the health workers that are working to try to find a solution.
And what about education and prevention among local communities?
It's a long work. Because it's a community work, because all the communities are slightly different, and because there's a lot of fear, a lot of cultural beliefs that are here and that have been here for many centuries. So we're talking about changing people's habits, and that doesn't come overnight. So it's a lot of discussion, a lot of talks. It's a lot of listening to people. There's a lot of tension around this disease because it's unknown, and people don't know where it comes from. They don't know. They see that there's a lot of people dying of it, so they're hiding, or there's a lot of misinformation about people doing even cannibalism around on bodies. So it's a lot of discussion, a lot of talks with communities, and for that we need people.
And as you roll out your help to the area that's been affected, do you see yourself expanding greatly your operations in that particular part of the world?
Well, we only expand our operations when we are actually requested to, which is what was the case in Sierra Leone. So we have our network of volunteers that are already present throughout the year in these different countries. Depending on what is the global plan and what is the request of the international community, we'll see how we can help to some measure, yes, of course.
Benoit Carpentier, Senior Communications Officer with the International Federation of the Red Cross and Red Crescent Societies. Thanks for joining us, sir.